All right, well, thanks for being here. I'm going to share my screen and walk us through the data, but please do not hesitate to unmute and ask questions or throw them in the chat. I can't really see the chat, but Kyle and Austin will be watching as we go through this. So let's dig in. We conducted this survey in April 5th through the 26th, and we use a bipartisan polling team. We have a Democratic pollster and a Republican pollster. That is really to make sure that we're asking questions in an unbiased way. We will interview anyone, Democrat, Republican, independent, no party affiliation. It doesn't really impact who we talk to, only how we ask the questions and how we make sense of the data. Folks can take the survey by phone or online. And this year we talked to 2,985 Coloradans. And with your help, we were able to speak to 276 people who identified as Native American or Indigenous. And I just want to note, because you'll see this as we go through the data, 139 of those folks are only Native American, and then 137 of those folks chose Native American and Indigenous and another racial or ethnicity. We have broken that out for you so you can see, and there are some interesting differences in the data. This year for Pulse, we also oversampled Black and African American Coloradans, Asian American and Pacific Islander Coloradans. So we have a really large and rich sample size that allows us to cut up the data. And most of what I'll share with you today is what our Native American and Indigenous respondents told us. And we'll share some comparative so that you can see how that stacks up against other groups. The overall margin of error is about 2.2. We're talking about much larger margins of error with this size. To reach folks, we take a list of addresses, and then we do a bunch of data matching. And then if we can find your telephone number, we might call you, we might text you. If we can find your email address, we'll email you. And if we can't find anything else, we'll send you a postcard in the mail. And invite you to take this survey, and you can take this survey in Spanish or in English. And that's how it's done. Any questions about the methodology? If not, I'll just move right along. All right. So in a couple places in the survey, and certainly if you dig in deeper to what we have available on the website, we look at information by region. So this is the breakdown of where people lived who took the survey. 3% in the Eastern Plains, 13% in El Paso, 3% in Pueblo, 11% in Larimer and Weld counties, 56% in the Denver metro area, 14% in the Western Slope. And we'll look specifically at Native American respondents and where they came from in just a second. In fact, here it is now. So before we look at what Native American respondents told us, I wanted to give you a picture of who they are. So a quarter of folks came from Adams County. We have a good sampling from Denver, El Paso, Jefferson, Larimer, and then we grouped all the others together because they were small segments of the population or pieces of area, I guess you would say. So not a surprise, we have a large concentration on the Front Range, but unlike some of our other groups, we do have 26% that came from outside of these kind of big Front Range counties. More than half of our Native American respondents were identified as female, 2% as non-binary. That's higher than most of the rest of the sample, which I think is interesting to note. Of our respondents, here's the age breakdown and then who are parents. So 60% had no kids under 18. The rest had some sort of kids, and those don't add up because you can have more, right? I can have a kid that's under 5 and a kid that's 6 to 12. Pretty good breakdown of ages. In fact, we got a fair number of young people, which can be really, really difficult to do because young people don't answer their phones, things like that. But it's because of your help and your network and who you know in your world that we were able to get a pretty good sample there of young folks. And then here we've got voter registration and income. So again, a pretty good look across income. We generally think of people living on low income as $50,000 or less. Sometimes we break it out in less than 20 to 50, but we generally think about people living on low income as $50,000 or less. And you can see we've got a really rich sample there, just about 30% of the sample, and then folks with higher incomes. For voter registration, pretty aligned, maybe slightly not aligned with how we see the overall population of Colorado. Again, this isn't a representative sample, it's a convenient sample. We partnered with organizations who knew folks, so we don't need to expect the same sort of parallel, right? Typically, we're looking at the whole sample. If 31% of the state's population is Democratic, we want 31% of the people we interview to be that way, or to identify in that way. In this case, we don't have that same rigidity, because we used a convenient sample methodology, but fortunately for us, it ended up being fairly close, maybe a little bit lax on the Republican side. Not too bad. Any other questions about this population? I'll note that I probably don't know the answer, but I can always get it. So any questions, feel free to put them in the chat, or just unmute and ask. Okay, I'll cruise right along. So one of the first things we do every time we ask a survey, and just to give you some context, the survey is about 46 questions. It takes about 21 minutes to do it if you're on the phone and somebody's reading it to you. You might be able to do it a little bit faster online. So we always start by just trying to get a sense of like, what are people worried about? What do they think of the problems in our state? And here is what folks told us when we gave them a list of problems and said, hey, how serious do you think these problems are? And what you're seeing here are the results of all Native Americans. So we have both Native people who identified only as Native American or Indigenous, as well as people who identified as Native American and another race or ethnicity. That is what you're seeing here. So you see 93% say the rising cost of living is an extremely or very serious problem. 83% say that about the cost of housing. Those are the two top concerns, and that not just for Native Americans, also for our entire sample. These were really concerned. Some interesting notes: mental health is a greater concern for Native Americans than it is for the general population. Homelessness is pretty similar, and as are many of the other things on this list. And I'll show you the comparative data on another slide here in just a second. One of the lowest concerns or items with the least amount of concern is the spread of new COVID variants. Really interesting. When we first started doing this survey in 2020, COVID was very, very high on people's list of concerns, and now much lower. Here you see 36% of our Native American respondents say it's an extremely or very serious problem. Here we are looking at respondents by racial and ethnic group, and then I've pulled out here the differences. Native American, only people who identify as Native American, and people who are multiracial Native American, and you can see the differences here. There's a lot of data on this slide. So I think the most important thing to note is that what I said earlier, the rising cost of living and the cost of housing are top tier across the state, across demographic groups, really with some shades of intensity, but there's no group who is not saying, whoa, the rising cost of living is a concern. The cost of housing is a concern. I will just draw that one distinction on mental health here. You can see it's 63% of all Coloradans, but it's significantly higher here for our Native American respondents. So that's one of the areas of greatest difference to note. And we did ask a number of other questions on mental health and who is experiencing mental health challenges. So we keep that in mind as we go down and look at these mental health numbers. I want to dig deeper into the cost of living, given what a big concern it is for folks. We did ask a number of questions about it this year. So we said, hey, what of all the things of cost of living that you're feeling pressure what are the things that are causing you the greatest pressure? And this was an open-ended question. People could say whatever they wanted. And you see, and they could say multiple things too. So I could have said rent, groceries, gas, right? And you would, that's why these numbers are like, do not add up at all. But you can see the top two things are rent and mortgage, right? And that is, those are very high numbers, right? If you add them together, you're above 2/3, I think. I don't do math without a calculator, but really a lot of pressure around the cost of housing for folks. And then food and gas, all the top are taking the top things. You know, a lot of times in years where we don't have this inflation and rising cost of living, you see healthcare much higher. And in this case, we've got these other issues really floating to the top. Again, you're looking at the responses for all Native American respondents. We asked folks if they felt like they were financially better or worse off than they were a year ago. And in this case, I want to draw your attention to the total worse number here. So back in 2021, 21% of Native Americans said they were worse off. Now that number has jumped to 37%. That's a double-digit increase there, and a concerning one as we are looking across the data, and we're seeing not just who is worried, but who is actually worse off and who is worried about what is to come with regards to their financial security. So here we are looking forward to ask, are you worried about affording food? And we've got a 10-point jump with our Native American respondents, 34% worried in 2021, now 44% worried about being able to afford enough food to feed yourself and your family. And then if you look here at the comparative data, our Native Americans are among the highest group to say they're worried. So look at that first column in the yellow. People who identify only as Native American, 62% are worried about affording food. That is a staggering number. And as you can see here, it is the highest racial and ethnic group. Really concerning here, raises so many questions for us that Pulse doesn't help us answer, right? Polling helps us answer a lot of questions, but not every question. Like, for example, we don't get to follow up and say, hey, do you have access to a food bank or a food pantry? You know, are you able to get help when you need it and that sort of thing? We're not able, that's not what polling can help us do, but this certainly raises some questions that many of us need to attend to. When we like to look ahead, what are you worried about? And then we also like to say, looking back over the past year, and in this case, we asked, have you skipped meals in the last year because you couldn't afford food? Overall, Coloradans, 16% have skipped a meal. That was a really scary number. It was a jump from last year. And then when you look at the Native American numbers, it only gets scarier. So 39% of people who are Native American only, 21% who are multiracial Native American. Again, look at it, when you look at these comparative numbers, it's the highest group on our list of racial and ethnic groups. So quite a bit of concern here about the health and well-being, right? When we think about, it's not just I skipped a meal, it's what are the health impacts that follow as a result of having to skip meals. So we tried to get a sense of, what are you worried about? What are your experiences? What have you had to do? What kind of trade-offs and compromises have you made? And then we put some policies in front of folks and asked them if they thought these policies would be effective or not at addressing the rising cost of living. And we looked at 4 different policies here, and Native Americans largely thought those policies would be effective. And the one that they believed to be the most effective is raising taxes on people making over $500,000 a year to cover services like housing, healthcare, and education. That is something that many of us are familiar with. We get a lot of questions on our ballot about raising taxes. This particular policy idea, 7 out of 10 Native Americans saying, yeah, well, I think that will be effective. You can see we also asked about increasing pay and benefits, changing government regulations to reduce costs, making government investments to stimulate the economy. So all of these things get 2/3 majority support. Here is the look across You'll see that in some cases, Native Americans are less likely to consider a policy to be effective, in some cases more likely. So an interesting note there, but largely there is a belief in the effectiveness of these policies. That's not, in some data last year, I recall our Native American respondents seemed to have a lot of lack of faith in government's ability to make progress on policy. Not really seeing that tremendously here. I'll pause for a second. Yes,
hey,
question.
Jay, we have a question from the chat. So it's from IMO. As a Native American person, I feel like making a multiracial category is something Native American people don't focus on. Is this important to the study? So can you talk a little bit more, since they've seen some slides now where we have sort of that breakdown about why we have that in the data this year and sort of the thinking behind it?
Imo, thank you so much for that question and for being the first one to ask a question. I know that can be a hard thing to do, so thank you so much, my friend. So this year, for the first time in our 3 years of doing Pulse, when people chose racial and ethnic groups, we let them choose multiple categories instead of just choosing multiracial, right? So in the past, you could say I'm multiracial, but then we didn't know anything else beyond that. So this year was the first year that we were able to say, don't just tell me you're multiracial, tell me your racial background or your ethnic background. And so we got this rich data, and in many ways have been figuring out how do we use it, because we know it feels like we are better understanding people, but we have a long way to go to learn how to make sense of some of this data. So this is why our approach this year has really been to make it available, to not pretend that we don't have some differences here. Now, I will tell you that there was a time when I was looking at this data that I thought, I only want to look at people who said they're only Native American, because I don't want to include, white people who are like, I'm 1/18 Cherokee. Sorry to throw a little shade, but I wasn't, I felt like we could be not fully understanding the experience, but ultimately what we've tried to do is to make it all available so that folks can draw their own conclusions, and it's not just wrapped up in my own biases of what data is or isn't important. It is all available, all important, and all useful. So we've made it available in this way. I think for folks like you who think about these communities all the time, it'll be easy to track and digest this. If I was talking to like a reporter, this may be way complicated for them. And yet, it feels important that we tell the story of this population in as rich a way as we can. I hope that is a helpful framing and response, and feel free to push back or ask more if you'd like.
Jay? Yeah, I just put in chat, is it safe to preface that when you're presenting this information next time around to a group of Native people? I feel like I'm thinking, how elders think and how they always want to, well, I've heard several in my whole life, actually. I've heard people, especially elderly communities, express that, we're not half, we don't number it, we are whole, we're a family, we're a community. And that's where I'm posing this question from. But I think that, it's good to say a little blurb about it before you present to your next group of Indigenous people, just to know that you are honoring not only, your data, but you're also honoring the people from the community that are actually thinking about how they view multiracial people. I don't know, just a suggestion. Thank you.
We love suggestions, and that's great feedback, especially because this was a first year, so we're kind of trying to make sense of it as best we can. So the more advice we can get about how to not just be accurate, but be inclusive, we want all of that. So thank you, Imo, and keep it coming. Anyone? Okay, I'm gonna move us along, but feel free, more questions are better. Less of my voice and more of your voice is for sure better. So let's talk about housing. If you'll recall a few slides back, this was a major pain point for folks. And you can see that it's just getting worse. So we asked, are you worried about losing your home because you can't afford the rent or the mortgage? And we have 38% of folks who are worried about that. Now, interestingly, that is not a number that is getting worse for our Native American respondents like it has for other population groups. But to be candid, it's always been higher for our Native American respondents. So in 2021, it was 38% of our Native respondents, but it was 21% of the whole sample. So in fact, it doesn't look like it's getting worse, but for this population, it's always been worse. And 38% is a really scary number. When you think about already the number of folks who don't have a bed, who don't have a roof over their heads and a safe place to call home, and the number of folks who are at risk is really staggering and concerning. Here's the comparative data. And you'll see across the board, Coloradans of color are more worried about losing their homes than our white Coloradans. But you can see again, our Native American respondents among the highest here. So when you look at total Native American, that's sort of to get at what Imo was talking about here. That's the number of all the respondents, right? Multiracial or not. So we've got 38% of all Native Americans saying, I am worried about losing my home. Such a scary figure, and you see among the highest. So we wanted to understand, because for most folks, they don't just lose their home, they work harder, they work multiple jobs, they cut back on other places to try to afford housing. We've all heard stories like that if we haven't experienced it. And so we asked, like, what have you done? Have you had to do any of these things in order to pay your rent or mortgage? And really high numbers here. These are all Native Americans. Half have worked multiple jobs or worked more than they wanted to, or they've cut back or gone without other needs like food or healthcare. Just for some comparison, and maybe the comparison's on the next slide, or maybe it's only in my brain, but it was about a third of all Coloradans. So much, much higher here for our Native American respondents, folks who are making these compromises, these trade-offs, in order to pay for their housing, which is just getting more and more expensive. Here's the comparison. I thought I had it. So again, you can see here that our Native American respondents are more likely than the sample overall to say they have had to make these difficult trade-offs. Again, these comparison data slides can be very overwhelming and difficult to process. You will get these slides after the fact, so you can sit with these numbers and not feel like you have to make sense of it all right here in this very moment. So we also asked about unfair treatment. And this is a language that we really struggled to land on. How do we ask this? But we said, please tell me whether you or someone you know has been treated unfairly when trying to rent or purchase a place to live. And I'm sorry, I should say, been treated unfairly as a result of race and ethnicity. So we're trying to get at how many people experienced unfair treatment because of their race or ethnicity when they were trying to get housing. And we have 39% of our Native American respondents said yes to that they or someone they know have been treated unfairly. You can see, of course, our Coloradans of color more likely to say yes to that. That makes perfect sense to me. But when you think about all of the compromises that we saw on the last slide that people are making to try to afford housing, and then you have unfair treatment and inequity on top of that, it's really people are in this almost impossible situation trying to keep a roof over their heads. We did ask folks about some policies to address the rising cost of housing. Again, we asked if they thought these policy ideas were very effective, somewhat effective, or not too effective. And a majority, and in fact, a pretty overwhelming majority at 80% said, hey, let's not let landlords raise rents too quickly. 75%, they want to require developers to build housing for people of all income levels. And then still a majority, 57%, want to reduce government regulations to speed up the building of new housing. So, what I take away from this is that our respondents believe that we all have a part to play in reducing housing costs, landlords, developers, government. Like, this is not a problem that just one of us or just one sector can solve. It's such a big problem. There's a lot of belief that we all have a role to play in trying to address this problem. Comparison data here to show, across the board, we have a lot of support for all of these policy ideas, majority, and then communities of color, Coloradans of color, more likely to support or more likely to think that these policies will be effective at making housing more affordable. I'll do a quick pause, see if we have any questions here before we shift away from housing. Questions, comments, what's sticking out to you? What's giving you heartburn, if anything?
Real quick,
Jace, if you're able, sorry, I know I was just going to point him to the chat, but you could go ahead and speak your question.
sorry, I don't know how I made sense in that. I was rereading it. I was like, So is there a way that you can narrow down these results regionally? Like I would like to see data for my region, not that I would silo that out and, but it's something to see. I think answers would be different if you narrowed that down regionally for our area as opposed to maybe Denver area.
Yes, so we can absolutely do that. We have the regions already ready to just like share. I could put it in an email for you today, but it's not based on racial group. When we do that cross tab, that is very possible. A word of caution, I think you already were speaking toward this, IMO, is that we will be talking about a much larger much smaller sample size, right? We're already talking about 297. When we go to region, we're going to get even smaller. Number 26% of the overall sample is not in one of those big counties, so that we're going to immediately be at 26% of 297. Again, I know I have my calculator in front of me, but that's small. So I can absolutely share it and just know that we're talking about it. We should think about it as directional, right? Because we're going to be talking about small groups of people.
Yeah, I'm aware of that. I just wanted to see what results look like.
Totally.
Thank you.
Absolutely. Anyone else? Thoughts, questions, insights to share? Okay. You know what? I'm sorry. As I was thinking about that, that's a little bit available now, but it would come. So I'll at the end of this, I'll demo our data dashboard that we have, and it allows you to choose Native American and a region. So you could do Native American and Western Slope. And it would show you the responses. So I'll if we have time at the end, I'll show you that. And if not, I'll send you an email and we can connect, and I'm happy to share that with everyone. Jobs and the Great Resignation. Big topic of conversation in the media these past many months. So we explored it just a little bit. We asked, first, do you plan on being employed? And then if you are planning on being employed, how worried are you that you might not be employed? We had about a quarter of Native American respondents say they are worried. That is a jump from 17% last year, not even a full year ago. So increasingly plan on being employed and are worried about an inability to find a job. You can see here the comparative data, worried Native American only at 47%, 22%, 24% here. So you can see that's why we pulled out the difference, because you can see what a stark difference here we have between people who are multiracial and people who are not. We asked folks, have you actively looked for a different job, had to take time away from work, got a pay raise or a promotion, just wanted to understand those experiences at work. And about half of our Native American respondents have actively looked for a different job, almost half taken time away from work to care for a child, a family member, or yourself. These are questions we haven't asked in the past, so we don't have comparative data year by year. If you look at the breakdown here by race and ethnicity, we see that Native American Coloradans are the least likely to have received a raise or a promotion. They're the most likely to have had their work hours reduced or their wages cut back. So some concerning numbers here. When we think about inequities in the workplace, these figures really make the case of the need for change and more equitable practices and policies and perspectives at work. Again, we asked about this unfair treatment. So in that same way, please tell me whether you or someone you know has been treated unfairly as a result of race or ethnicity when seeking employment. We have some pretty high numbers here. Overall, Native American respondents, 45%. When you look at all demographic groups, or excuse me, all respondents, 24%. So significantly higher here for Native Americans than Coloradans overall, and it is the highest of all of our racial and ethnic groups. I see some numbers rising in the chat. So if I can pull that up here, I think I can figure it out. Any questions anyone wants to speak in the space? Oh, I see IMO is taking a look at the data dashboard. Thank you, Austin, for sending that link. We can do a demo here. Any questions, thoughts on jobs, Great Resignation? All right, let's go to healthcare. I'm going to keep us moving so we do have time to play with that data dashboard at the end. So healthcare, we asked folks, are you worried about going without health insurance coverage in the next year? You can see 57%, a really strong majority of Native Americans are worried about that. And you can see the trend data is a marked increase from 42% of folks worried about going without health insurance coverage. This is one of those scenarios where polling gives us a data point like, whoa, that's a really high number. And then we don't have the ability to say, why are you worried about this? Is there something happening? And so there are a lot of questions left unanswered, but important thing for us to be aware of and to get answers through other methods, focus groups, or working with the communities we serve. We work with our grantee partners to help us find and understand what's underneath the numbers. When you look at the comparative data here, Coloradans of color across the board are more worried about going without health insurance than are white Coloradans. You see about a third of white Coloradans, and then all of our communities of color much higher than a third. Concern here, and this is a bit of a chorus line, right? You can see across the board when we look at worries, our Coloradans of color, our respondents of color are more likely to be worried than white Coloradans. Again, we asked about unfair treatment, and this was when seeking health services. Have you been treated unfairly based on your race or ethnicity, you or someone you know? We've got 38% of Native American respondents say yes. That's much, much higher than the 21% of all Coloradans, the highest of our racial and ethnic groups, as you can see in the breakout here. And then we asked folks, when you think about all this, unfair treatment, concerns about losing coverage or not having coverage, it sort of helps you understand, why would someone postpone care? Oh, here are all these reasons, right? We've got 2 in 5 Native American respondents say they have postponed medical or dental care in the past 12 months. And what I don't want us to think of is, wow, 2 in 5 people aren't taking responsibility for their health. That's not the case when we consider all this data that we have, when we think about the financial insecurity, when we think about the insurance insecurity, when we think about experiences of unfair treatment, right? It complicates our thinking when we don't just say, oh, 2 in 5 are not taking care of themselves. It's like, you know what, that's a lot more complicated and nuanced when you look at the data as a whole. Here are here's a question on COVID. We just really only asked a couple questions on COVID this year. And in this case, we wanted to look ahead and ask folks if they were confident in the state's ability to respond to a pandemic in the future. 56% of Native Americans are very or somewhat confident. You can see the comparative data here. Not a resounding amount of confidence. As you can see, only 18% are very confident among our Native American respondents. But an interesting data point, as many of us are thinking about what is a return to normal? How do we not go back to the normal? How do we make sure we're prepared for a future threat like this? So an interesting question, maybe one we'll continue to explore as the pandemic shifts to more of an endemic. Okay, I'm about to jump to mental health and well-being. So any questions about healthcare? I'm pulling up the chat here. Imo, you are exactly right that income is a major factor here. And on the dashboard, which I know might be overwhelming, you can look specifically at Native Americans who live on low income. And I think you would see even more staggering numbers when you look at these sorts of worries. Let's talk about mental health and well-being. We're getting close to the end. If you're thinking, please don't show me any more charts and graphs, we are close to the end, my friends. Mental health is still an issue. So when we first asked this, we first started the survey, I was shocked. We said we had about a majority of Coloradans, I think it was 52%, said they had experienced mental health strains such as anxiety, depression, loneliness, or stress in the last year. And I thought, oh my gosh, okay, well, it's 2020. We'll see that number go down. That has not happened. It has gone up. It is getting worse. In this case, we have 7 in 10 Native Americans who say they have experienced mental health strain in the last year. You can see in the list here, these groups who are most likely to have experienced mental health strain. And man, it sure is a lot of different kinds of folks. And it's just staggering and concerning that we are not getting better. So that first year I thought, oh, it's people are isolated and lonely and they're so stressed out about whether or not they'll have a job or whether or not they'll get sick. Surely it will get better. And sure enough, it has not. We asked folks then, given, if you said that you have experienced mental health strain, we asked about getting care. And if these reasons or these factors have been a challenge to you or a family member accessing mental health services, out-of-pocket costs were by and large the most overwhelming thing that people said were a challenge. You can see 74% of our Native American respondents who have experienced mental health strain. So we're talking about 112 respondents here. 74% say services are too expensive. A majority say, I can't get an appointment or the wait to get help is too long. A majority say, I'm unsure how to find a provider. And a majority say, I'm concerned about having to disclose too much information or about privacy. A majority, again, not feeling comfortable speaking to a stranger, not being able to find a provider who understands your background and your experiences. About half are concerned about being judged. I mean, these are really higher numbers or high and concerning numbers here. You can see Native Americans are especially likely in this comparative data to say they couldn't find a provider who would understand their experiences. Something we hear a lot at the Colorado Health Foundation anecdotally, and then folks who are worried about having to disclose personal information. So when you look at the comparative data, you can see, okay, we've got high numbers of people experiencing mental health strain. We've got a lot of problems at play here, but when you really zoom in on what are the unique problems being experienced by our Native American respondents, we see it's finding someone who understands them and disclosing that personal information. You can see how those two go hand in hand, right? And a really clear need that is not being met for folks. We asked about some policy proposals again, we asked, how effective do you think it will be at improving mental health, requiring health insurance to cover mental health services without copays, creating more options for people to access care where they live, pairing mental health professionals with law enforcement to respond to mental health emergency calls, majorly high levels of support, more than 8 in 10 for every policy by Native American Coloradans. They think these will be effective policy solutions. I see some numbers going up in the chat. Anything that anyone wants to voice into the space here? If not, I'll do a quick read of the chat. Monique, thank you for chiming in on the chat here. and IMO. I know this is exactly the work that you do.
Yeah, we're helping out quite a bit with the medical. You know, Connect for Health really helps people in the gray area. Medicaid is great for Native Americans. We don't have any deductibles. And as well with Connect for Health, we have no deductibles. So that really helps out. And we're just getting everybody educated about what's out here.
I had a question about that, Monique.
Yeah.
I used to work for an insurance agency that had a health insurance person there. And when I was working for them, I was in that gray area. I was making too much for Medicaid, but I also was unable to afford the insurance at work, the health insurance. And so I applied for Connect for Health. I got in, and then the insurance person told me that we started going deep into health insurance. And he told me that anybody who's utilizing Connect for Health while they're working with the agency that or employment that actually offers health insurance, then they shouldn't qualify and we could get penalized for that. So I had to drop myself from that Connect for Health, fearing that I did something wrong. So I got off of that, and I left that job and then ended back up on Medicaid. So
Wow.
but this was 3 years ago. This was before the
Yeah.
pandemic. I don't know if it's changed with Connect for Health.
I never knew that, but
yeah.
I went to the insurance broker and she knew I was working, and you know, we could get insurance, but I just go through Connect for Health, and she knew that I could get insurance. She never said anything, so I don't.
Okay,
That's a good
yeah, it was an
point.
insurance broker, so I gotta double check again on that. Okay, thank
Yeah.
you.
Thanks.
Thanks, y'all. We've got, I think this is maybe my last section, and I'll breeze through it. There's not that much data left here. And then I want to show you the dashboard for folks who really want to geek out on this stuff with me. I know some of you have to leave at the 12:30 hour, so I want to pack as much in as I can. And for those who can stay, we can talk as long as you want. Alcohol and drug use. Most folks said a plurality, I guess I should say, if I want to be specific, said there, alcohol and drug use stayed the same or decreased in the past year. 13% said increase, 7% don't know. Interesting. Yeah, I'm not sure. I track my my usage as closely as I would want. So interesting data there. And then we've got 16% who say they are worried about the amount of drugs or alcohol they consume. And you can see that there are a number of demographic groups that are quite high. 16% here is not among the highest. We've got a lot of racial and ethnic groups and other identity groups by age, sexual orientation, and gender identity who have higher levels of folks saying, I'm really worried about how much alcohol and drugs I'm consuming. Again, we asked about a number of policies to see if folks thought it would be effective at decreasing alcohol and drug use. Really high levels of support, 85% connecting people trying to recover from addiction with support from other people like them. This is something we work a lot on at the Colorado Health Foundation. We support a lot of programs, these peer support programs, and 85% of folks are Native American respondents saying, wow, that would be really effective. That's such a high number. Making treatment for addiction more affordable and more available. 8 and 10, investing in programs to prevent, so drug and alcohol prevention programs, 72%. And then the one that we saw was most difficult for some folks to support, sending people to treatment, not to jails or prisons, if they've committed a crime related to alcohol or drug use. Still 69% of our Native American respondents saying that would be effective. So really interesting numbers. Oh, I lied. This is the last section, crime and policing. A couple of data points here. We asked folks specifically about crime. This is something that folks are increasingly concerned about. We've asked about it a couple years now, and concern is going up. We've got 47% of Native Americans saying it's extremely or very serious problem. Our Native American respondents are not the most concerned group compared to some other groups. As you can see, white Coloradans and Asian American and Pacific Islander Coloradans Hispanic Coloradans, all more concerned than our total Native American respondents. And then to complicate this, right, we ask about police violence. So, you know, who is concerned about crime, and then how would they feel about policing? And so we've got 32% who say police violence and misconduct is an extremely or very serious problem. You can see, though, this is a place where people who identify as Native American, not multiracial, are very, very, very much more likely to be concerned here. I see a hand raised. IMO, go right ahead, unmute. What is your question?
Yeah, I was confused. The other slide right before this one, you said that a high number of Native Americans were not very concerned about the seriousness of crime. So I'm looking at the stats that you're showing, but what you said don't align, or is it just me that I didn't hear it right?
Well, it is entirely possible I said it wrong. So let's just not even figure out who got something off, because it could have just as easily been me. But I will say, when you look at the total Native American here, we've got 47. And what I was trying to say is they are not the highest group with the concern. So there are other racial groups that are more concerned than our Native American.
Sorry. Yeah, you were going out like, so I was like, oh, thank you.
No worries. And then we've got so back to this police violence piece here. So I just think it's interesting. We've got to complicate, we use these questions to complicate the assumptions we make when we think, oh, people are concerned about crime, let's have more police. But then you say, oh, the same people, or what percentage of people are concerned about crime are also, you know, really worried about police violence. So again, a lot of times polling leaves us with more questions that can't be answered, and this is one of those areas. We also asked folks if they've experienced unfair treatment when interacting with law enforcement as a result of their race and ethnicity. And you see, so all Coloradans, 29%, say they or someone they know has experienced unfair treatment, but we've got 51%. Holy crap, that's a really high number, right? A majority of our Native American respondents saying that they or someone they know has been treated unfairly as a result of their race or ethnicity when interacting with law enforcement. So this is all complicating this, what I think is the sort of assumption that is too often made, where we're really concerned about crime. Crime is going up. Let's have more police. And when you look at these data points, you sort of see it complicates that question, you know, and adds quite a bit of nuance into the puzzle here. Okay, now I am done. What questions do you guys have? What insights do you want to share? I'm going to stop sharing for a second, and I want to pull up the data dashboard. But while I'm doing that, before folks have to start leaving questions, insights, what's sticking out to you, what's worrying you, anything?
Hey, Jace, this is Aaron from Denver Indian Health and Family Services. Just wanted to say thanks again for, you know, taking the time to go through this data and to reaching out to the organizations that you do to increase these sample sizes. And I'm glad to see that it's getting better, you know, each year, and being able to break down those sample sizes a little bit better and getting better sample sizes. I don't have any questions about the data. I think it's pretty in line with, unfortunately, what we tend to see trending in Native American populations and communities. But I was curious to know what you guys do internally at the foundation with the Pulse Poll data, and does it drive anything, or does it factor into like additional projects or programs you guys fund, or does it help with kind of guiding like what communities and geographic regions you guys can be working with on a more frequent basis? I mean, I know the foundation, you guys do an amazing job with funding not only clinics like ours, but, you know, minority and underserved communities and organizations. I would actually take my point of view would be that you guys are the leading foundation in Colorado that really does that. But so definitely kudos to you guys. But I was just curious to see, you know, if what you guys do with the data internally, and if it does, you know, factor into projects or programs that you guys fund kind of going forward on a yearly basis.
I am gonna phone a friend here and have Kyle answer that as somebody who has his hands in a lot of things over at the foundation.
Yeah, it's a great question. And as you may know, like one of the cornerstones that we have at the Health Foundation for everything that we do. So whether it's our overall strategy, sort of the priorities, the focus areas that we take on as an institution, our funding strategies, our sort of public policy advocacy work that we do in each of those areas. A key feature in all of that work is community engagement, being informed by the communities that we exist to serve. And so a tool like Pulse is a really powerful instrument of listening, but it's not the only way that we engage in communities and all that. And so you heard Jace mention multiple times over the sort of his walkthrough of the data and all that, is that like looking at sort of quantitative data like this can give us more to be curious about, more to dig deeper on in conversations with communities across the state of Colorado. So if nothing else, like we use this as a way to sort of sharpen, what are the places where we should be asking deeper questions and having more extensive conversations with folks in communities and all that, whether they're folks, who are leaders in organizations like you, folks on the ground in the different corners of the state of Colorado, because, to one of IMO's questions earlier and all that, like we can look at this data for Native American folks in Colorado overall, but it doesn't necessarily get us to all the nuances about how is life different for folks who live on the Front Range or the urban corridor of Colorado compared to the southwest corner of our state and all that as well. So this is a tool of listening for us that we use to inform some of the strategies, some of the funding decisions that we do, but it's not something that we ever look at in isolation. We hold this data up with richer information that we get from actual conversations with folks on the ground across the state of Colorado as well. But just like we're sharing this information with you all as well, we make it publicly available in lots of different ways, one of which Jace will demo for you in a moment with the data dashboard on the website. So we share this information with media, with policymakers and all that as well, in the hopes that like it sparks their curiosity too, that they're able to sort of ask deeper questions, have a deeper understanding about sort of the richness and the complexity of experiences of Native American folks here in Colorado. So that informs decisions, not just that we make at the foundation, but folks who serve in the legislature or work for Medicaid in Colorado or any other number of institutions in our state as well. This is something that we hope sort of leads to a better collective understanding of what life is like for people in Colorado. We like to talk about Pulse as sort of like a mirror that we hold up to the state to help us understand what's going on in Colorado. But just like a mirror, it shows us sort of like the surface level stuff. And so for us, we don't want our conversations, our curiosity to stop at the surface, but we really appreciate the relationships that we have with you, with your partners and your communities as well, to help us to get below sort of the surface level of what we're able to learn from Pulse as we're making funding decisions or other sort of important things that we do here at the foundation.
Great, thanks, Kyle.
Hi, real quick, I have to
go
go,
for it.
but I have something really quick. I'm sorry, Jace.
No, you're good.
So I recently attended the Colorado Health Symposium, and I attended one of the breakout sessions, which was Project Mosaic. And we had 2 members of Native American communities presenting, and a lot of their demographics is what really pulled me in. So they had a lot of their demographics involving the heaviest populous areas in Colorado. And then the most populous areas of indigenous population were in Denver. And then the second most populous was in Southwest Colorado, predominantly in Montezuma County and La Plata County. And one of the things I wanted to know was, since we have the second largest Native American community here in Colorado, how can we promote, when is the next time we can promote this survey? And is there a way to incentivize people that will take the survey?
Love that. So a couple of things. One, let me show you how you can see the data. This is the data dashboard. It's on the results page and you scroll down. I'm just going to hit housing because I want to show you how you can look at what we have now. So you can look at Native American and Indigenous, select that. And it sort of takes a second, and then you can go down below and say Western Slope. And now you are looking at the respondents of only Native Americans who live in a Western Slope zip code. Look at that, 100% of them say the cost of housing is a problem. Wow, I've never seen 100% before. Thank you for making me do this, Ima. So that's what we have now. And we do Pulse every year. And it's only with your help that we get this Native American sample. If I just randomly called people from their addresses, I would still be calling to try to get folks, Native Americans, to take this survey. So we will do this again next year. We haven't decided on the timing, if we'll do it either in summer or fall. This year we did it in summer because of the election. We wanted to have policymakers to have this data as they're on the campaign trail. But we absolutely need your help in one way. Is like, are there other humans who can circulate? Like Ima was new this year. She helped us this year. We found her through our colleague Kine, and her home base is in the southwest corner. So are there more folks who can circulate? We give incentives to organizations to circulate, but it's a great question to give incentives to the participants. And I think that's something that I'd want to ask our research people. Like, is there anything that, if we offer incentives only to Native Americans, is that okay? Is that not okay to only offer it? What does that do to our data and the scientific nature of it? But I love that as a suggestion. And I will say the most helpful thing you could do immediately is help us identify others who will circulate it next year, because that, just adding a few folks this year took us from, I think we had about 107 or 140 or something last year, and we doubled it. So it's been an amazing jump this year. I'm so appreciative to all of you. And I know you're somebody who had to leave at 11:30, and I'm just rambling on.
No, it's okay. We're okay.
Okay,
I
Kate's
texted
good,
and
okay.
I pushed our meeting off a little bit, but I want to, relatedly to IMO, I just wanted to say that, I have the great fortune of working in Southwestern Colorado with IMO and Monique. And, but I also wanted to tell you that we do a lot of work with Fort Lewis College, like public health students, and Jason, and we have a Native American nursing pipeline program we're just starting up, and a community health worker certificate program with Fort Lewis we're starting up. And I think it would be really great if someone from you or someone from your organization could present this data and how you collected it to students, both because you're building these healthcare professionals, Native healthcare professionals, who can address some of the issues that came up, with care in our state, and also build support for respondents, because they're all members of communities here in Southwestern Colorado, and could really be part of your outreach to get more respondents in this part of the state. So
I would love that. I generally just love being the center of attention, as Kyle well knows. So I usually very rarely say no when somebody says, come talk to us about data. So we're happy to share that with groups like that, or others that you can think of. And the other question I have that I'd love all of your advice on is, what do we do next? This data is available in a couple of different formats. Like you can look at this data dashboard. But then there are other things we could do. We could make the slide deck available. We could write a blog post. Kyle, what else can we do? We could do briefings. We could do many, many things. What would be helpful? Like, what actually helps you when you think about who you would like to share this with? You want like graphics for social media or something else? I don't know. You have better ideas probably than I do.
the one thing that I think would be great that comes to mind, sorry if I jumped in on anyone, but is that, IMO and Monique both put in the chat that they have all these amazing programs that are addressing some of the data points that came up in this presentation. And so, the data is definitely like showing deficits, the problems that need to be addressed, but I certainly know IMO, and I'm more familiar with IMO's, but I know Monique's doing amazing work, is that she, all the use of white bison and culture to really, promote resilience and strength building. So it might be nice to have the data with some of these amazing programs that are happening and out of the tribal communities here in other parts of the state, to just kind of demonstrate, to balance out what you see in that data. But IMO and Monique, jump in and see if you agree or disagree with that.
I totally agree. And I know IMO and I have worked together, you know, I try to send people from the tribe to the Wellbriety because I think it's a great program. So,
Yeah, I think that I would second that. That's it.
Thank you for that. So one, I saw in the chat that graphics for social media. So we have some that are already available. I'm on the page now. It's the partner toolkit page that you could share. But if you're like, you know what I really, really want, like we have native data in here, but it's not exclusively native data. So if you thought like, here's an example of one, you know, I bet this is super duper small on your screen, but it's, you know, talking about who have skipped meals. But if you said, hey, we really would love to use, you know, specific Native American graphics on postponing healthcare or mental health or whatever, we could make those. And maybe Austin can put his email address in the chat, or mine in the chat, or both in the chat, so you could reach out and say, we would love to share this, and this is the data that really aligns with our mission and the conversation we're trying to drive online. And then I love that that idea, Kate. We you know, I have such a hard time like writing blog posts, and it's always disparity. And so I love enriching that with stories of good work that's happening. And so my colleague Austin, he and I work on Any Pulse communications together. So between our two brains, I hope that we can remind ourselves to do that. And one of the things we've been debating is, do we do a blog post this year about Native Americans? How do we tell the story of this great story of resilience and not just disparity? And so I think you may be hearing from me again, and you may regret that you offered to help, but I would love your thought partnership, maybe reviewing a draft or something, or how we could lift up the story of your work, Monique, your work, Imo, your work, to help that.
Yeah, and just weaving together two threads of the conversation already, you know, for what it would take to get an even better sample for next year, more representation from Southwest Colorado. As an example, one of the things that we're happy to work with you on throughout the year is if there are presentations in community or ways of sort of like, you know, reporting this data back to folks in community. I think that that's also something that could help with the participation in the survey overall, is if folks sort of see this in action in institutions that they trust and that they know sort of close to home wherever they are. So please do not be shy, whether it's Fort Lewis or sort of other places where you think a conversation, not just a presentation or something like that about this data would be helpful. We're always happy to do that with you.
thank you.
Thank you, everyone. Any other advice, questions, thoughts? Imo, I see you waving. Thank you. You will be bothered by me soon. If you have to go, that's okay. Anybody else? Is that a waving goodbye hand, Aaron?
That's an applause for you guys.
Applause.
Appreciate all the work you guys do.
Thank you so much.
Thanks to all of you. We really couldn't do it without your help. I really, truly mean that. And we're available. You've got our email addresses. We'll reach out to you and you reach out to us. Thanks, folks. Really appreciate it.